Nearly 500,000 people among 11 indigenous communities with separate culture and language live in Chittagong Hill Tracts. This region is extremely remote, hilly area. It has been a conflict-ridden area with very little socio-economic development. Dropout rate in Chittagong Hill Tract schools are very high due to remoteness and language barrier. To address this problem, Phulchora, Chakma villagers built a school which was maintained by themselves. The community managed the teachers' remuneration by selling bamboo and wood collected from the forest. However, over time it became difficult to sustain. Manusha Janna Foundation, with the help of a local NGO, came forward to help such a noble initiative. At present, nearly 100 students are studying by their own language. The education program supports 200 schools. After primary education, students are linked with boarding schools and involved in skill development training as well. Presently, Manusha Janna Foundation is supporting poor ethnic minority through 14 projects in Chittagong Hill Tracts, focusing on income generation, environment-friendly jhum cultivation and crop diversity, improved livelihoods, maintaining their culture and language, and education programs for children. Manusha Janna Foundation, through its governance performance monitoring program, monitors health service delivery at 85 unions in 12 districts. The community and the leaders monitor service delivery performance of local health centers in a participatory way.
আমি মতিউর রহমান, স্বাস্থ্য অধিকার প্রকল্পের প্রজেক্ট ম্যানেজমেন্ট কমিটির সভাপতি। আমরা প্রজেক্ট ম্যানেজমেন্ট কমিটি করার পর থেকে ক্লায়েন্ট অ্যাসোসিয়েশন আমরা গড়ে তুলেছি বিভিন্ন এলাকা বিভিন্ন ইউনিয়নে।
They formed client association and reviewed the complaints submitted to the complaint box at health center. As a result, at the end of 3 years of program implementation, there are major improvements like the number of patients increased in the health centers, patients are getting allotted supplies from the centers, doctors and support staff's attitudes towards patients is now much more positive.
আগে কখনো এরকম ছিল না। আগে আসলে আপাগো ঠিকমতো পাওয়া যেত না, চিকিৎসা পাওয়া যেত না, ওষুধ পাওয়া যেত না। এখন 2 বছর যাবত আসলে খুব ভালো ব্যবহার করে ওষুধ পাওয়া যায়।
Hamida Hussain, an eminent development activist of Bangladesh, evaluated Manusha Janna Foundation work.
Manusha Janna has now been supporting many organizations, particularly small ones outside Dhaka, and have been able to actually, with all their partners, carry on very active campaigns for the defense of human rights and for reform of governance structures.
Challenges: ensuring relevance and necessity for initiatives such as Manusha Janna Foundation treading a neutral path in a politicized environment, maintaining internal control and state-of-the-art system of transparency within Manusha Janna Foundation, measuring poverty impact in a rights and governance program, bringing cohesion among or between very varied and diverse groups of partners. Bridging the missing link between micro and macro level interventions are still major challenges. Steve Godfrey, external evaluator who carried out evaluation of Manusha Janna Foundation, analysed his evaluation experiences.
Manusha Janna has been supported by the British government through its aid programme over the last 5 years. I think one of the most impressive things about Manusha Janna, when you go and look at the work they're doing in the field, is that they are really engaging in a respectful and genuine way so many of the most disadvantaged and poor people in communities across the country, the landless, women who are subject to violence, children whose rights are abused, workers working in very difficult circumstances. One of the most important things about Manusha Janna is not that it's just for the people, but that it's also a Bangladeshi institution, led by Bangladeshis, has the credibility and the knowledge and the sensitivity that comes with that from their fellow citizens.
Manusher Junna Foundation activities are diversified, which have already been addressing complex factors associated with human rights and governance. Capacity development of partners must go hand in hand with funding in order to measure impact of partners' work. Coordination and sharing between Manusher Junna Foundation partners has built synergy and contributed to a shared vision. Some service delivery is essential for the extreme poor and excluded people. Many partners have improved their internal governance, advocacy strategies, gender awareness, etc. due to partnership with Manusher Junna Foundation.
In looking ahead in the next 5 years, Manusher Junna Foundation would like to see a better governed Bangladesh with fewer rights violations and people living in more dignity and human security.